Wake up, wake up, wake up,
That's
wake up,
what I was
wake up, wake up,
doing.
wake up, wake up, wake up.
I had to slap myself.
Were you asleep? Oh, we're gonna wake you wide up right now. We're gonna wake you, so you're gonna be eyes open when you watch this next interview.
That is so true, because
Yes.
this morning we've been learning all about non-surgical treatments for both athletes and non-athletes at UR Sports Medicine, like dry needling and acupuncture. There's a difference.
I know, and you know, Ashley Forsbacher is there this morning, and she is learning all about this. Not only is she learning about it, she's actually having it done. You had some dry needling done earlier. That got everyone in the studio like, you could hear a pin drop, no pun intended. Now what's next?
No pun intended with a pin. No, I had never heard of dry needling before, and it was really cool to see. It was super quick, didn't hurt me at all. But there's a difference between dry needling and acupuncture. And joining us now to talk about that is Dan Dominguez, and you are a licensed acupuncturist.
Correct.
So talk a little bit when everybody just saw the dry needling. What's the difference between acupuncture and dry needling?
So one of the things is, in order to do acupuncture in New York State, you have to be licensed, and that requires 4,500 hours of didactic and clinical work, including a master's degree. A difference between the two is dry needling treats your elbow or your neck. Acupuncture treats your whole body. So there's the root, right? The root is what causes your neck pain. That could be stress, that could be depression, that could be just...
It could be your job, not that I'm saying mine does it. But
it could be your job, right? But acupuncture gets down to the root of why it is that you have pain, or digestive issues, or stress or anxiety. And it treats it from that end, as well as treating the pain that you're having. So dry needling, I think, is a component of acupuncture, but done at a very specific area, while acupuncture is done both locally, right, in your shoulder, but I can also treat your shoulder from your hand. And just having a deeper understanding of what it is that the needles do is important in making a distinction between the two.
And you brought up the needles. Oh, I just spilled a little bit of them there, right? They're teeny little. A couple of help, but these are what you do. This is what you use.
So this is the needle that you saw in the last segment is a Japanese style needle. This is a traditional Chinese style needle. We use both that style as well as this style when treating people, depending on people who have sensitivity to needles, or what it is that I'm trying to accomplish. When I'm treating pain, I typically use a needle like this. I find it to be very comfortable for patients. If I'm treating stress and anxiety, I'll use sarin needles, like the ones that Dr. Rizzoni used. So we have a wide variety of different treatment styles and needles that we'll use.
And there's a lot inside your magic cabinet
so this
here.
is where the magic happens, right? You know, so in here we have different sizes, different lengths. We have ear needles. We have needles that I'll use on the face. We have Chinese herbs that I'll use on the skin for different issues, muscle, tendon, inflammation, pain. So those are all incorporated into treatment as well. So it's not just put a needle in, take it out. We do body work. We do Chinese cupping, similar to what Michael Phelps had done in the Olympics. We use a tool called a gua, which is similar to the Graston technique in chiropractic, where we're breaking up muscle adhesions with a tool. So the nice thing about acupuncture is it's just not a needle. It's treating the body from a whole and using all the tools at my disposal to get someone better.
And we were talking about, just because this is sports medicine, it's not just for athletes. You see people, all kinds of people with different things, what treatments and different things. If somebody's at home and they're thinking, oh gosh, I've had this aching, or I've had this for a while, what would you say to them?
I'd say put down the bottle of aspirin and come see me. I treat chronic pain. It's probably the biggest part of my clinic here. A lot of low back pain, a lot of neck pain, arthritis. I treat a lot of athletes. I've had the opportunity to treat Buffalo Bills, Olympic athletes, and junior Olympians, as well as collegiate athletes around Rochester. But the biggest part of my clinic is done treating people age, probably the youngest I treat is 13, the oldest patient I have right now is 88. So
any age can do it.
Anywhere and in between. That's right.
So we are going to be trying some acupuncture and some stim, right?
Yes, we're going to do electric stim as well.
And see my muscle jump. So if you thought the needle in my arm got everybody quiet, wait till you see my muscle move. It's going to be really cool. We're going to do that coming up at 8:05. Yes.
Oh, okay.
Huh.
Okay. You got our attention.
Have fun with that,
Thank you,
Ashley.
Ashley. Ooh, okay, she's brave.